Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McCain.
And welcome to this edition of The Distinctive Dermatologist. As you may know, we are now both audio and video with our podcast presentations. And as always, The Distinctive Dermatologist is brought to you by Gentle Cure from Skin Cure Oncology. Gentle Cure, tough on cancer, easy on skin. And we're going to be talking about skin cancer today and the treatment of skin cancer. I have a very special guest, a good friend of mine. He is the Chief Brand Officer of Gentle Cure from Skin Cure Oncology. His name is Adam Lefton. And Adam, it is great to have you on the podcast at long last. Thanks for taking time to join me today.
Scott, Gentle Cure by Skin Cure Oncology is a proud sponsor of your Distinctive Dermatology podcast. And I'm glad I finally made it onto the show.
At long last. Well, Adam, there is something new, and Substack is a platform that is growing by leaps and bounds. Talk about something with momentum. It seems like all the blogging and many of the podcasts and everything has moved to Substack, and what's going on with you is certainly no exception. And that's the Skin Cancer Treatment Journal. So the first question obviously has to be, why did you start the Skin Cancer Treatment Journal?
Sure. It's really all about informed consent, Scott. Patients need to know about all of their options, not just the default one. And we really started the Skin Cancer Treatment Journal because there's a huge gap between what's being told and what patients are actually being hearing.
Yeah.
And so we needed to make sure that people diagnosed with skin cancer are presented with all their options, not just one pathway, which is typically Mohs. The journal is really our way of elevating the conversation and giving physicians and patients a place to explore the data, the ethics, and really the realities that are shaping treatment decisions today.
Well, you mentioned data being a part of this, and I would imagine if somebody is watching, hearing about you for the first time and as Chief Brand Officer, a natural question might be, is this really about education, or is this a marketing tool that you've created? How would you respond to that?
Sure. It really is about education. It's education first. If we wanted to market, we'd be talking all about our product, Gentle Cure, but that's not what we're talking about here, especially with the Skin Cancer Treatment Journal. What we're talking about are uncomfortable topics, quite honestly: policy, incentives, delayed adoption, even trust in medicine. That's not typical marketing speak.
Yeah.
That's thought leadership. And frankly, I think it's a conversation that the industry needs.
Yeah, absolutely. And we've had that with a skin cancer patient just a few weeks ago. We had it with a marketing and customer experience expert with Joe Calloway last week. And I guess it also brings the question, you're talking about data, you're talking about the traditional treatment being Mohs surgery. So you're clearly challenging Mohs through this. Are you saying it's the wrong treatment for patients?
Not at all, right? Mohs is an excellent treatment for many patients. The issue isn't about Mohs. It's really about the absence of choice. Mm-hmm. Problem is, when it becomes the only option presented, even when a less invasive, clinically appropriate alternative exists. And our belief is that patients need to be told about all of their options, yes, not just the option that one particular doctor may be offering to his or her patients.
So does that get to the core problem that you're trying to fix? I'm not going to make an assumption. What is the core problem that you're trying to fix through the Skin Cancer Treatment Journal?
Sure, it's the lack of fully informed consent.
Yeah,
I mean, at the end of the day, patients assume that they're being given all their options, right? but often they're not. And then when they find out later, what happens, Scott?
Yeah.
Trust is lost, right?
Trust is eroded, yeah,
Right.
or destroyed.
Right.
Yeah.
Exactly. So it's really more than a clinical issue. It's a patient experience issue.
Yeah.
How do you like that? I told you I'd work the patient experience.
You absolutely did, and you're singing my song there. I love that. Well, over the years, as I've had the privilege of working with you personally and working with skincare oncology and learning about gentle cure, one of the things that often happens is these dermatologists are so well trained in their field. They are such experts at their specialty, but that doesn't necessarily make them an expert on the patient experience and on patient communication. And that's one of the ways that this really seems to me as somebody that, I work with the leading companies of the world on this in many different fields. And it seems to me that it's something that has to be a part of this is how you communicate, how you bring options is what builds trust. I was doing a program. I've just got to say real quickly, I was doing a program the other day, and one of the questions I got asked, and this was in the technology field, is give me a statement. Somebody's raised their hand and said, give me a statement that would build immediate trust. And the best I could do on the spot was to say, when you say, we don't have the best option for you, we can be of service to you in another way later, but right now we don't. But you only build trust when you provide the options for the customer, the patient to consider. That's when you really build trust. And that's a core problem that you're trying to fix.
Scott, we had getting off on a little bit of a tangent here, but I'm happy to do it. When I was with Cancer Treatment Centers of America, the number one pet peeve of mine was when somebody would call our call center to discuss treatment at Cancer Treatment Centers of America, because they were leaving one of the most renowned cancer treatment institutes in the world, right? And it happened a lot, right? And what we would hear from those patients is, I was told that there was nothing more that could be done. And in reality, that's a terrible thing to say to a patient, because it's actually self-serving and not really true.
Yeah.
What these institutions should have said is, I'm sorry, there's nothing more that we know of that can be done.
Yeah.
But instead, when they say there's nothing more that can be done, they strip away all hope, all options, and patients pass away. And I'm not saying that at Cancer Treatment Centers of America, we saved every patient who came through our doors. Far from it. But we saved some.
Yeah.
And for others, we extended their life with a high quality of life for months, if not years. And so that's the battle I fight every day. It's those doctors and those institutions that just feel like they've got the only answer.
Yeah.
And if they don't have an answer, there is no answer. And in the world of skin cancer treatment, all too often, we hear doctors saying to their patients, I diagnosed you in this practice. In this practice, we do Mohs surgery. We're scheduling you for Mohs surgery. And the conversation ends there. Can I give you a statistic?
Yeah. I love it. Yeah.
I'm going to have to read this one to you because I haven't memorized it yet. But a survey published a couple of years ago and was recently updated showed that only 26% of patients receiving surgical intervention totally agreed with the statement, I was fully informed of all potential treatment options before surgery. Let me say the number again. Only 26% of patients who received surgical intervention. Now, compare that with what patients receiving radiation therapy said. 74% of them said they felt fully informed of all their treatment options before treatment began. 74% for people who receive radiation therapy, only 26% for people who receive a surgical intervention. That tells you what you need to know about what's happening when patients are being told by Mohs surgeons that they need Mohs. They're not being told about their other options.
And I guess that leads to the next question, which is, why is this so important now?
Yeah. So the data is finally caught up with the technology, right? We now have all the options like image-guided SRT with outcomes, right? We could see those outcomes in the studies, right? And those outcomes say that image-guided SRT provides a comparable, if not slightly better, cure rate, right, for appropriately treated patients. So now the responsibility shifts
Right.
from proving that it works to making sure patients know that it exists.
That's an important distinction. Well, Adam, over the years, one of the things I've heard you say several times, and I don't mean to throw you a curve with this one, but you talk a lot about history repeating itself. Would you mind to share what you mean by that and how you see that happening with what's going on right now at this moment?
Sure, I'm not a doctor and I'm not a historian, but if you look at how slow adoption has been in areas of medicine where a better treatment option came along, and yet it took forever for patients to experience the benefit of those new treatment options. You can look at things like heart disease, ulcers, HIV, stroke care, mastectomies, right? All of those things were performed, treatment for all of those things were performed in ways that historically had been used forever,
Yeah.
right? A better option came along, and yet it took years and sometimes decades for doctors to change. So you have to ask yourself, why did so many women have to undergo radical mastectomies in a day and age when the industry knew, right, that was not going to be of benefit to those patients,
Yeah.
right? So the question isn't whether skin cancer treatment becomes the next example. I'm sorry, that's exactly the question. The question is, when is skin cancer treatment going to become the next example,
Yeah.
right? Or are we going to learn from history and move faster this time?
Yeah. Yeah. That's so important. What are doctors intentionally withholding these options?
I could give you the political answer, Scott, or I could give you the correct answer. And you know me, I'm going to give you what I believe to be the correct answer.
The truth. Yeah.
I wish I could say no, doctors are not intentionally withholding this option. But the truth is, many Mohs surgeons and many radiation oncologists are not providing fully informed consent. We've got the numbers now through the surveys to show that, right? And the associations that represent them are actively doing whatever they can to make it more difficult for patients to receive image-guided SRT, for example, right? In the end, they're going to lose, right? Because in the end, better medicine is going to win and patient choice is going to win. Unfortunately, it's going to take a long time before the industry does the right thing.
I'm so reminded, and you've heard me say this before, but I'm so reminded of the companies that had taxi medallions in New York City and Chicago and other places that were trying to prevent Uber from getting into the marketplace. Well, the customer wanted it. And at the end of the day, the customer is going to win. They just drug their feet, but they couldn't stop it. Blockbuster all of a sudden started waiving late fees and everything else, trying to fight Netflix. Didn't work. I mean, it's hard to find. It's hard to find when there's a technological advance that the instant reaction by those that are winning at that particular times to dig in their heels to try to prevent the advance. But the more customers learn about it, the more customers know about it, they're able to delay it, but not to deny it permanently.
Even I fought Uber for a while, to be honest with you, until I was outside a hotel in a kind of a remote area of Arizona, and it was one of those resorts. And I went outside and I stood outside with my suitcase after leaving the event, and I waited for 10 minutes for a cab. No cab showed up. I went to the front desk and they said, "How old are you? What's a cab?" Use Uber. And I actually had to sit in the lobby and download the Uber app. And that's when I used Uber for the first time. And once I used it one time, Scott, I got it.
There you go. Exactly.
And Uber has clearly won. I got to tell you, though, I think that they've had their day.
Yeah.
If you go to a city like San Francisco now and you start to see these remote cars without a driver, it looks like that's where everything's going to be headed next. So times change.
Yeah, and I just saw where Uber made a significant investment in Lucid, the electric cars, to help prepare them for the next phase. So rather than digging in their heels and trying to prevent it, they're saying, how do we change our company so that we can offer that service as well? That's the word. Well, hey, Adam, this seems like a good time during every one of these podcasts as we've gone video is we have a message about Gentle Cure from Skin Cure Oncology. So Adam and I will be right back right after this from Gentle Cure.
I started playing golf when I was 10 years old. so I've been in the sun my whole life.
Last year, we noticed a spot on Brian's lip. We were very concerned, and we went to a dermatologist.
When I found out it was skin cancer, I was in the middle of a tournament. The dermatologist was recommending surgery, so I was going to miss time on the tour.
I saw a commercial for a treatment called Gentle Cure. It didn't require surgery and meant no time away from golf.
If you, like millions of others, are affected by skin cancer, it's important to know that surgery isn't the only option. There's another choice, Gentle Cure. Gentle Cure uses low-energy X-rays to kill cancer cells with a 99% cure rate. There's no cutting, no surgical scarring, and no downtime.
Thanks to Gentle Cure, my cancer is gone, and I didn't miss any time on the course.
We've been fortunate. We wanted to use our platform to get this message out. There are options, and patients deserve to know.
To learn more, call today or go to gentlecure.com.
So, Anna, we're back, and we just saw a great testimonial by a PGA golfer of what Gentle Cure has done for him. Could you tell us a little bit more about what makes Gentle Cure different?
Sure. Let me first say we're really proud of Brian Gay, who represents us now. He did have skin cancer. He obviously allows us to say that. He's been in a TV commercial. He and his wife, Kimberly, are phenomenal, and they are really dedicated to helping people to know about a less invasive treatment option. So we're grateful for that. So the question really is, what makes Gentle Cure different? A lot of things, but I'll talk about three of them very briefly. First, the technology, right? The technology allows us to see and measure the tumor under the skin, both before and during treatment. So that allows for what we call an adaptive radiotherapy protocol, and that improves the outcome from the treatment delivered. That's how we get that 99.3 to 99.6% cure rate. From a model perspective, we help dermatologists to run a cancer center level model of care right in a dermatology practice. So for example, all of our practice partners have access to weekly grand rounds, just like you would in a hospital setting. From a values and motto perspective, we live by our values. We live by our motto every day. Our values are integrity, gratitude, servant leadership, respect, and teamwork. We've instilled that in everybody who belongs and works for the company, both inside and outside the company. And even more importantly, our motto, or the code that we live by, it's first and always about the patient.
Yes.
Every company's got a motto. Everybody kind of throws their motto out there. But I've got to tell you, we really do live that. And the way it manifests itself is whenever a decision's being made around the table, and we're trying to decide between a couple of ways that we could go, somebody invariably during that conversation will say, let's look at this from the patient's point of view. What's best for the patient? And that's the direction that we will go in.
Yeah, I've been fortunate enough to be sitting at the table on a few occasions when I hear you or others ask that question, and it's great to see, that shameless self-promotional plug here, but that's one of the things I put in my latest book, was there was a whole lot of difference between saying what your values are and having posters on the wall, but actually living the values in meetings. It's not about just standing out, it's about what you stand for that makes all the difference.
I'm a big believer, in do what's right. If you do what's right, people will come back, people will support you, right? People will recommend you, right? So there's actually a little bit of selfishness in doing what's right.
Sure. Yeah, exactly.
It also feels good to do what's right.
Absolutely. Well, if people weren't really all that upset about cabs, but then Uber disrupted it anyway. We were using that example a little bit earlier. So if patients are happy with Mohs, why disrupt it?
I love that question. It's sort of like asking somebody, hey, when did you stop kicking your dog? Right?
Yeah.
Patients are not happy with Mohs, right? Again, back to that survey I talked about a little bit earlier. A recent update to that study showed, there were more than 1,000 Mohs patients surveyed and more than 500 patients who received IGSRT, right? Only 25% of Mohs patients surveyed said they were happy with the results of their treatment. And you
Wow.
can compare that to the 91% of patients who had IGSRT and said that they were happy with the treatment. So huge discrepancy between the two. If you think that's something, Scott, do you want to know how many Mohs patients would actually recommend Mohs surgery to a friend or a loved one?
Well, and that's the standard of the customer experience, right? I mean, that's the score
Yeah.
that people look at. That would you recommend us?
Yeah.
That's how every business judges the success of.
Yeah, and I'm not going to give you the answer today. So the study's not been released yet, but I'll give you a hint.
Yeah.
Right? I told you that 25% of Mohs patients were happy with the results.
Yeah.
The number that would recommend Mohs to another person, it's less than 25%.
Wow.
I'll be happy to come back on the show some other time and share that.
But that's great information.
Hey, Scott, before we move on to the next question, I got to make something really clear.
Please.
Right? That part about kicking the dog, right? I have 2 dogs. They are collies. I love my dogs. They're a brother and sister. Their names are Ash and Tara. Right? They rule the house. Nobody kicks my dogs.
By the way, that's the same way with Lucy and Chloe in my place. I'm with you 100%. Hey, we're kind of circling the field, about to land the plane here for this episode. But if there's something that you want to make sure that the viewers, listeners take home, that take away, what would that be? What's the central element of that?
Yeah. I think that the Uber message here is, and not Uber, the car service, but the overarching message here is progress doesn't really come from choosing sides. It comes from expanding the conversation, right? And the best practices in the future are not going to be defined by one modality. They're going to be defined by giving patients the right options in the right situation and making sure that patients know about all of their options and the potential side effects of each of those options. Yeah. So that's really my message for the dermatology community.
It kind of sounds like you are trying to change and alter, dare I say, improve the standard of care.
We're all about that. That's why we started the Skin Cancer Treatment Journal. It's why we're putting those articles out there now. I invite everybody in the dermatologic community to read those articles, to respond to those articles, to share their thoughts. At the end of the day, what we're trying to do is make sure that patients know about their options, right? They know about the side effects of each option, and that they can work with their dermatologist to choose the option that they feel is right for them.
And I would be remiss if I didn't at least try to get a little bit of insight about what's coming next. And by the way, this is available on Substack. We said that at the beginning. Let me emphasize that again here at the end. All you need to do is to go to the Substack app or substack.com online and search for Skin Cancer Treatment Journal. We'll also have the link in the show notes, as they call it, that can send you there directly. But what's next on the horizon as well? Could you give us just a little sneak peek of what you might be talking about when you come back on the show again in the future?
Sure. In the very near future, Scott, I've got a couple of interesting things going on. The first, I referenced one of those surveys. We actually have 2 surveys right now that we've been looking very closely at. One we did, the other one was done by the Dermatology Association of Radiation Therapy. Our survey, more recent, covers patient perspectives on skin cancer. And the survey done by DART, or the Dermatology Association for Radiation Therapy, was the non-melanoma skin cancer patient experience. That study was recently redone, multi-thousand Mohs patients, I think more than 1,000 patients receiving radiation therapy. It's a big study. The numbers seem to be valid. These are big studies. These are big surveys. They're not small little surveys. And they're the first ones I think that we've seen that cover some of these topics. So I'm really excited about the insight that everybody in the dermatology community is going to get when they see what patients have to say. Second thing I've got going on relates to the market size for skin cancer and its treatment, and the number of patients, the number of Americans who are diagnosed with skin cancer each year. If you go online, if you talk to a dermatologist, everybody gives you the same number: 3.3 million Americans are diagnosed each year with non-melanoma skin cancer. I've been with skincare oncology for 8 years now. That same number is the number that's been floated for every one of those 8 years. And it goes back even further than that. I think the origin is like a 2012 study, right? And in that study, they actually said that 3.3 million Americans are treated each year, which would mean that even more than that would have been diagnosed.
Yeah.
So that number was already an understatement, right? And they said that the number was growing rapidly. And yet, here we are more than 10 years later, and we still talk about the same number.
Yeah.
I've been frustrated with that for a very long time now. To do an actual survey or census of the population would be very expensive, very time consuming. We couldn't do that. But what we could do is use logic to say if the number was 3.3 million back then, what is it likely now? And using some AI tools, using some analytic tools, we've worked our way through. And the number now, we believe, is 4.7 million Americans are diagnosed with non-melanoma skin cancer each year. So I can't speak for the industry, but we will no longer be talking in terms of 3.3 million Americans. It's 4.7 million Americans diagnosed each year. We're going to put that paper out. We're going to get it published, and we're going to try and get everybody in the dermatology community to, at least for now, say that sounds like a more reasonable number. That's the number we should be using. And if somebody comes back with a more rigorous method for coming up with a more accurate number, more power to them.
Yeah.
I'll embrace them. I will buy them dinner. This is something that both the dermatology community and all of those Americans who are diagnosed with skin cancer deserve to have an accurate number.
Absolutely. Adam, I can't thank you enough for your time and for your insight. This has been powerful. And once again, I want to invite everybody to read what you're posting and what others that are committed and concerned are posting as well on the Skin Cancer Treatment Journal on Substack. And again, we'll have the link here in the show notes for everybody to take advantage of that. Adam, thank you. Thanks so much. And once again, our thanks to Gentle Cure from Skin Cure Oncology. They're our sponsor of the Distinctive Dermatologist. This is Scott McCain, and I will look forward to seeing you on our next episode next week.
Thanks for listening, and join us next time for the Distinctive Dermatologist with Scott McCain.